is a problem. Since the onslaught of COVID-19, there has been a disparity in our hospital infrastructure. It has been widely exposed as being inadequate, not able to serve the needs of patients, not having enough adequate equipment and manpower to battle this pandemic. Our hospital infrastructure has not been able to keep up with technology, and the sad thing about it is our very life is dependent on technology. We are truly under siege with no end in sight. This COVID pandemic has forced us as consumers to look at the digital platform in a new and different way, especially in healthcare. We are asking serious questions. Can I see my physician and get my vitals taken without endangering my life? It has forced us to look at the healthcare in a new and different light. Now, I want you to imagine yourself as a patient being hooked up to the machines in the hospital. Now, these monitoring devices are being shrunk down and implanted so you, the patient, are living your life, yet generating thousands and thousands bits of data from your body. This data that are generated from your body through the medical implants are utilized and diagnosed using cloud and AI application and warp speed. What our physician and health providers need is the data, your data. Your data to be able to provide a customized treatment for your body. Now, one of the current application of cloud in healthcare is data storage and process. Data is king, and it's all about the data. According to the article in Cloud Solution Review titled 8 Benefits and Risks of Cloud Computing in Healthcare, the healthcare industry works with a tremendous amount of data, and even the most sophisticated hardware installation can't handle it all. Cloud networks allow healthcare professionals to store all the data they use offsite to avoid the cost and strain of maintaining physical servers. Listen, if it's not for this valuable data that's being generated now because of this pandemic, we probably would not have had this COVID-19 vaccine created in such an unbelievable amount of speed. So why is this important to me? Well, I am a mother of 4 daughters. I lost my youngest daughter to suicide. I currently have 2 daughters who are pregnant and are considered high risk. I birthed 2 daughters who were premature, and one suffered many skeleton problems. So being pushed into this reality, I came to realize as an engineer, there has to be solutions to optimize our healthcare. So I have skin in this game. My vision has been to design a healthcare system that uses technology such as cloud and AI to customize our needs and our healthcare system. So when I was in graduate school, I did a proposal on cloud-based building system. I showed the impact of migrating hospital patient building system into a cloud infrastructure and what it would do to the hospital productivity. I proposed using cloud providers such as Microsoft, Amazon, and Google as an example. Now, my vision now includes expanding our data volume capacity, as well as updating our data infrastructure using data applications such as Microsoft Azure Data Lake, Amazon Kinesis Strings, or Google Cloud Big Data. Collaborating with our rural hospitals to share technology and accessibility to customize healthcare plans for residents in that county. With cloud, we can compile and analyze data of coal miners who work and reside in counties such as West Virginia, who have experienced generations of Black lung disease, or residents who live in the Mississippi Delta experiencing lifelong problems of diabetes. We have the data, we have the technology, but do we have the innovation and desire to be problem solvers and solution providers? Now, companies such as Amazon and Google and Microsoft has created some amazing cloud infrastructure designed for our healthcare system. For example, AWS has created the HPC on AWS COVID-19 research, and the AWS Diagnostic Development Initiative, which is DDI, helps provide support for dialysis, treatment, and vaccine studies. COVID-19 data set that's created from Johns Hopkins is available now on the AWS Exchange. Now, in response to the COVID-19 pandemic, Microsoft has partnered with Allen Institute for AI, who also has partners with leading research groups to prepare and distribute COVID-19 open research dataset. Now, this is a free resource of over 47 scholarly articles, including 36,000 full texts about COVID-19 and the coronavirus family of virus for use for global research community. According to Computer World, Google had launched a project called Project Nightingale, and it uses AI and MI solution in helping healthcare organizations like Ascension to improve healthcare experience and outcome. 83% of IT healthcare organizations are currently using cloud service. 9.3% plans to, and 6% do not intend to adopt cloud-based application, according to Forbes magazine. 92% of healthcare providers now and in the future see the value of cloud services for their organization. Ladies and gentlemen, we can do this. We have this amazing cloud technology to improve our healthcare system for our society and for our world. So I'm reaching out to each one of you to continue this conversation, inviting you to come up with new and innovative ideas so we can use to improve our healthcare system using cloud and AI. Because my skin in this game is to find ways to provide equity healthcare system that would enrich the life of my daughters, my grandchildren, our community, our society, and our world now and in the future. Let's talk. You can contact me at rcummings43@gmail.com or call me at 380-550-8216. Thank you very much.